is so good for not like because it is like so good. Yeah.
Okay, so cirrhosis, basically it's chronic, irreversible, inflammatory, fibrotic liver disease. Basically, it just means that once that starts, you're pretty much, you're going downhill from this point, okay? The liver cannot regenerate, okay? It's the leading cause of death in the US. It used to be really, really common, more common in men than women, but that's changing because women are drinking just almost as much as men, and they're in high stress jobs, and yeah, so women are catching up, which is unfortunate. What's that?
We're just being silly.
Lisa? Is there something you'd like to share with us?
Even equality.
Even equality, okay. Well noted. All right. So this is how long it takes, okay? If you have somebody that chronically drinks, is doing all the things to mess up their liver, you have the normal liver right there, okay? They could have an infection at some point. They could have Hep C, okay? So we're going to use Hep C as an example because that is one of the most common reasons that this happens. So we have Hep C, okay? Chronic hepatitis. Let's go 25 to 30 years later. You've got a dead liver, okay? Yeah, it's nasty.
Is there a stage where the cirrhosis becomes no longer reversible?
That's a good question. I don't know. Does anybody know if the particular stage in liver disease, if once you've hit that stage, that is irreversible? I couldn't find it, but it's a good question. Okay. So the patho behind it, basically you have destruction and inflammation throughout all of the hepatic cells, okay? Necrosis leads to fibrosis, so if you can think of all the nasty, kind of like fibroids, okay? It's almost like that. The structure and the vasculature are altered, okay? Blood and lymph flow are impaired, and basically the liver is just not working at that point, okay? You can look at the patho map, but we're not gonna focus on that. We're gonna focus on what we should do as nurses, okay? This is what it looks like, okay? Healthy liver that's no longer able to regenerate. Manifestations, hopefully you guys have not ever had these issues with yourselves. So we already talked about the upper right quadrant pain, okay? This is that pruritus, okay, all the itching on his hands. What's this? Ascites. And then what's this? Yeah, it's like the spider angiomas.
This is a sign of alcoholism.
What's that?
This is a sign of alcoholism.
It is. It's a sign of alcoholism. So it's kind of funny if you go into a restaurant or whatever, and it's a restaurant with a lot of older people. That's one of the first things that you'll notice on their noses, on older gentlemen. Okay, if they have a lot of issues with their livers. Okay, so spider angiomas, and also the jaundice. Okay, and exceptional fatigue is also there. Okay. Let's talk about the clinical manifestations. You've got that little picture there, so that pretty much says it all, okay? Fatigue may be the only symptom, okay? That's pretty benign, right? We're all in nursing school, and yeah, we're tired all the time. Also, during any point in your life, if you could be tired, and I'm trying to make this very clear because it's a very benign symptom, okay? What are some of the later manifestations? You can see it right here, okay? Jaundice, peripheral edema, ascites, you have issues with your skin, okay? Neuropathic, so you can have that encephalopathy, the confusion we talked about, okay? Muscle wasting, basically the body is just trying to find some sort of sugar or protein, something to keep it going, so it's actually going into that state of ketosis. Dilated vessels, red palms, you see the jaundice, And then the liver, if you've ever, I mean, when we're doing our assessments, you know, we're taught how to palpate and all that. If you can feel the liver, sometimes that can be a real big issue, right? Okay, you're kind of feeling it and it's kind of hard, all right? Complications are a result of liver failure and portal hypertension. What is portal hypertension? Just in a real basic sentence.
High blood pressure in the portal vein.
Yeah, right? You have super duper high blood pressure in the portal vein, okay? So if you have that, and you have all that pressure, okay, what does your body do? What does your body naturally do?
It's gonna try and reduce the pressure by either diuresing or then starting vasodilation.
Yeah, so it's doing everything it can to try to reduce that pressure, right? But also, what it does is kind of makes other little pathways, right? Okay, you have all that peripheral vasculature, okay? Your body naturally kind of creates that, okay? So, in terms of the complications, these are the biggies. You have the varices. What are the varices? Tell me what varices are.
Like enlarged vein.
Enlarged veins, right? They're almost like, what are those veins in your legs?
Varicose veins.
Varicose veins. They're like varicose veins, right? But you can see varicose veins. You can't see these kind of veins, right? You can't see it in the esophagus, right? So you have to have a special test for the doctors to know that you have this, right? Okay, it's down in the esophagus, so you have those varices, those extra little vasculature that your body's created, okay? Peripheral edema and ascites, okay? Hepatic encephalopathy. The ones I really kind of want to focus in on are the varices and the coag problems, and we're going to talk about that here in just a minute. Does everybody understand the process behind portal hypertension? Everybody clear with that? How that happens? Okay. If you don't, here's a diagram for you, okay? So you have cirrhosis of the liver, you have that portal hypertension, so you have increased pressure in the portal vein, okay? Your body naturally wants to have that extra vasculature, okay, so it does that. And then you have the ascites, right? All the pressure is building up, and you have all that extra vasculature. I don't really like the bottom part of that model, but if you look at the top, that really says it all.
So these are the veins transporting nutrients from intestines to liver to be processed, and that's backing up.
It is.
And then out of the capillaries where they meet the intestines. Site.
Yeah, that's exactly right. Yes.
So what is it about the cirrhosis of the liver that's causing the portal hypertension? Is it like, is that scarring and like hardening, like just constricting the vessel and then
Yeah.
that's what's causing it, or?
That's exactly right.
Okay.
And I don't know to what point when the portal hypertension would start. You know, I don't know how much pressure you would need for all of this excessive vasculature to start all the problems. Yes.
Could all forms of hepatitis, probably besides A, lead to cirrhosis? I know we said C, but like B, and I feel like then if you got B,
I didn't think about that.
because a lot of the, from the book, like a lot of the manifestations of chronic hepatitis are like
From
ascites.
hepatitis. Yeah,
like-
yeah. I don't know, I'd have to really think about it. I would agree with you at first thought, because it affects the liver.
Okay.
Yeah. Okay, so this is one of the complications of cirrhosis, portal hypertension. Okay, you have normal blood flow through the portal system, it gets obstructed, okay? All that excessive fiber, the liver is getting really hard, so things just can't get through the way it normally does. So the pressure increases, and that causes you increase in your spleen size, you have all the extra vasculature that we just talked about, and then you have varices. And that all is part of the collateral circulation, okay?
That's why the spleen is literally just backed up work.
So these are your big complications, Okay, the varicosities develop in areas where the collateral and systemic circulation communicate. Your body is trying so hard to figure out what it needs to do to keep running. So that's what it's doing. This is the extra vasculature that it's creating all through here. Okay? You can have it anywhere, really. Okay? Anywhere in the body. You can even have it in the rectum, is what I read in the book. Okay? What is the most life-threatening complication of cirrhosis? So let me back up. So if you have these varices, okay, if you can think of it, these varices are extra veins, okay, extra vasculature. They're super, super thin, super fragile, okay? Your body has created these because it's trying to do its job. And you have blood flow going through these very, very thin vasculature. What would you think could happen? Rupture, right? That is the huge complication. That's the most threatening complication of cirrhosis. Okay, having those varices just kind of explode, for lack of a better word. So if you had a patient that was bleeding from varices, let's just say it wasn't a rupture per se, but the like explosion. Let's just say it was a slow leak, okay, through these varices. As a nurse, what would you look for?
GI upset and dark stool.
Mm-hmm. GI upset and dark stools. What else? Yeah.
Coffee grounds, vomit.
Yeah. So if it's coffee ground, vomit, what is that saying?
There's blood coming back
It's
up.
old blood,
Yeah.
right? Okay, if it's bright red, what is it telling you? Fresh, right? Okay. Yeah, so you're looking at their stools. Are they black, tarry stools? Okay. If they're vomiting, do they have like coffee grounds in the vomit? Okay. All these are signs of internal bleeding. Okay. I mean, you can look at your labs and stuff, but if you have a patient that's just coming in and they're giving you their symptoms, ask them those questions. Those are the questions that you ask as a nurse. And those are the things that you're looking for in the hospital as well. And that's just a picture of one of the varices. Complications. There are a lot of complications to cirrhosis, and I've really cut this lecture down because you're going to be getting more and more liver throughout your front range experience. So you're going to get a heavy med surg in third semester. You're also going to have a little bit more in fourth semester. So this is a very abbreviated lecture for the liver. So just so you know, these are the complications we're going to focus on. Peripheral edema. Who has seen that? I mean, I know everybody's seen edema, but have you ever seen one that you can actually put your fingers on and your fingers stay?
Yeah.
It's kind of scary, right? It's like, oh my gosh, now you know what pitting edema is, right? I never know if it's like a +3 or a +4, but it's a lot, right? Okay. Ascites, and then the hepatic encephalopathy. Those are the three that we're going to focus on today. Just those. Okay, so ascites, you have that third spacing, right? Okay, all that fluid is going where it shouldn't be. Okay? What kind of electrolytes are you going to be looking for? Everything, right? Okay, if somebody has ascites, you're looking at all their electrolytes, in particular potassium. What happens if they have bacterial peritonitis? What's going to happen? What are some of the symptoms? What would you think if somebody had a really nasty soaring infection all of a sudden? High fever, right? Okay. Okay. What would be the best way to determine somebody's weight for third spacing? Like, so you recognize their third spacing, right? Okay. Would you be more concerned with what they're drinking, what they're peeing, or would you weigh them? Weigh them, right? Because you don't know where all that fluid's going. Okay. Complications. Encephalopathy, okay? Basically what happens is your body can't the liver is not doing its job, it can't, right? So it's supposed to filter all the toxins, and it can't. So it builds up in your body. So you have a buildup of ammonia, all the nerves are not working the way they should, everything is inflamed, okay? So you have this huge inflammatory response, okay? But the big thing is that you have that buildup of ammonia because your liver can't do its job. These are some of the things that you'll see, okay? Complications of hepatic encephalitis, okay? So change of level of consciousness, that's pretty obvious. Changes in behavior, sleep issues, extreme fatigue, apraxia, what's that?
Liver flap.
Yeah, okay, the flap. What about esoterics?
Always.
What's that?
I got that one.
I always thought the flap was apraxia.
I think Asterix was
Axoteres
the
is the
flapping
liver flap.
tremors.
Oh,
where you
did I
hold
get it
out
wrong?
your arms and they.
Which one is which?
I wanna say the Asterix is, the second one would be, the Asterix is the flapping tremors.
Okay, and
It
then
is.
the apraxia, did I mix them up?
The apraxia says inability to perform tasks or movements when asked, even though the request or command is understood.
Okay, okay, can you say that louder? Because I don't want people to get confused, because I got the two mixed up.
Apraxia says a person is unable to perform tasks or movements when asked, even though the request or command is understood.
Okay, everybody get that? Okay, and then apraxia and esoterics. Just make sure you don't get those mixed up, okay? Vector hepaticus from constipation, what is that?
Bad breath.
It's super, super bad breath, and it smells like poop, okay? If you've ever smelled it, it's really nasty. My cat had it. It was awful. Okay, and that's just because everything is building up, right? Okay. These are the different stages of what you may see when somebody has this, okay? So you have severe cirrhosis, okay? I know you all can't see it, but they have stage 1, and you don't need to know the stages. These are just different pictures of things that you may experience in the hospital. So stage 1 is just personality changes, okay? And they have a stare to them, like a vacant stare. Stage 2 says lethargy or flapping, tremors, and muscle twitches. Stage 3, that's the one that I knew of, the abusive and violent and very, very noisy. And then stage 4 is coma, okay? And the doctor's like down by his mouth trying to smell his breath. So that's that vector hepaticus. Nasty, nasty. Okay. As a nurse, this is what you're looking for. These are the biggies, okay? You're doing everything you can to prevent bleeding and hemorrhage. So if somebody is actively bleeding, what do you do? Besides, like, wet her pants.
Stabilize, into airway.
Stabilize your airway, right? That's the biggest thing ever. ABCs, right? What else?
Try to find where?
What's that?
Try to find where.
Yeah, try to find where, right? What else are you gonna be doing?
Document how much.
Documenting how much, but you're calling the doctor, right? After you've wet your pants, okay? You wet your pants, you call the doctor, you get them they're sitting, right? You're trying to do everything you can to make sure to minimize the activity, right? Okay? You're protecting that airway, number 1, okay? You're also making sure you're looking through their history if you can, okay? Did they have any NSAIDs? Have they taken any NSAIDs, right? Because what do NSAIDs do?
GI upset. and
GI
even-
upset, right? They could cause ulcers, right? They can also do what with blood?
Thin blood.
Thin your blood, okay? You want to prevent straining, excessive coughing, vomiting, obviously you know why, okay? If active bleeding, you're gonna stabilize, manage the airway, and place some IVs after you've called the doctor, okay? The band ligation is something that they do in endoscopy, really. Basically what it is that they have the varices and they put these little bands around the varices to kind of close them off, okay? Basically, it's just like a little rubber band, per se, okay? That's what banding is. So it says all patients with cirrhosis should have an EGD, that's that endoscopy that we just talked about, okay? And also you're gonna be doing, beta blockers, non-selective beta blockers. Okay, so they have all this ammonia buildup. This is what you're going to be giving them, okay? The goal is to reduce that the ammonia in their bodies. And one thing I wanna talk about, let me go back here just for a second. Super important. Okay. So, this is the medication that the doctors are gonna be giving them, lactulose, okay? Lactulose traps the ammonia in the gut, and then they can poop it out. Okay, you can give it orally or with an enema. The important thing that you recognize how the action, okay? Lactulose traps the ammonia in the gut so they can poop it out, okay? Also prevents constipation, okay, that's one of the things that can happen. And then, of course, you're gonna be treating any other causes, something else that's going on, if they have an electrolyte balance or an infection, that sort of thing. So this is like nursing care 101, what you would do. So I wanna go back to one slide. So let's talk about the spleen, okay? So, what would be the best slide for that? Okay, this one will work, all right. So you have an enlarged spleen, okay? What do you suppose is going on with that spleen? I know we've talked about this, but I wanna make sure everybody understands it.
Clogged and backed up.
It's clogged and backed up, right? So it's sort of like over, whoop. There you go. It's sort of like overworking, right? Okay, because it's clogged and backed up. It's trying to do everything it can. So when it's clogged and backed up, it's removing too many blood cells from the circulation. Okay? What happens when too many blood cells are removed from the circulation? What's going on?
Poor perfusion.
What's that?
Poor perfusion.
You have poor perfusion, but what's going on with the blood in particular?
Thinner, less viscous.
Has a low platelet count. Okay, what's the word for a low platelet count? Yeah, okay. So that's a really big thing that you might find with the complication of cirrhosis. Does everybody understand why and how that happens? Okay, so we've talked about nutrition. Okay, malnutrition is a huge problem, so you're gonna be giving them as much healthy food as you can, but in small, frequent meals, right? And we're talking super high calories, 3,000 a day. That's why I think that they give them that drink that tastes so bad. What is it? Starts with an E. Ensure? Yeah, anybody ever tasted that?
Yeah.
It's gross, right? But it has a lot of calories to it, so that's good, okay? So small frequent meals, moderate to low fat. Sometimes the protein can be restricted, but it's really based on what's going on, and low sodium. Why do you want a low sodium diet?
Decreased portal hypertension.
Yeah, decreased portal hypertension. And what's going on with all that fluid? We're gonna hang on to that fluid, right? If they have increased sodium. Okay, that's all I got for this. Okay, yes.
So I looked it up, and hepatitis B and C both lead to cirrhosis, so is there kind of differences
Between the two?
in the symptoms that you want us to know, or just more so like treatments for cirrhosis versus?
Treatments.